Thank you. I take that as a sign that you're as impressed with the way the day is going as I am. I mean, it's just packed with information and good dialogue, and that will surely continue with this next panel on emerging policy initiatives and communication strategies. This will be moderated by Dr. Kelly Brownell, who's also a member of the Standing Committee and a member of the IOM. He's the James Rowland Angel Professor of Psychology, Professor of Epidemiology, Public Health, and Director of the Rudd Center for Food Policy and Obesity at Yale University. His work is focused on environmental factors that contribute to diet, nutrition, and obesity, the specific effects of an environment that encourage overeating and physical inactivity, bias, prejudice, discrimination, and obesity and food prices. These are all things that he works on, well known in this field. Food prices and food consumption patterns, and public policy as a means of changing eating and activity in the population. So I will turn this over to Kelly, and he will introduce the panel and invite the session speakers up to present to you.
Thank you, Shariki. I hope you've all enjoyed this conference as much as I have. The presentations have been absolutely fascinating. And I think we're going to have a good panel coming up. And we'll be talking about some things that haven't been covered so much today already. You know, I was thinking about putting the picture of food marketing to children in a broad context. And I was wondering if we were, say, living in Sleepy Hollow, New York, and our name was Rip Van Winkle, and we'd fallen asleep in 2006, right after the big report came out from the IOM, and we just woke up. What would we see? What sort of a picture would we see? Well, we would see far more impressive documentation of the amount of food marketing, a lot bigger body of research. We would see the scientific community, primarily because of lack of funding, way behind the technology advances that the industry is using, but doing good studies nonetheless. But what we would see would be more marketing than ever. We would see more ways unhealthy foods are being marketed to kids. We would see more exposure overall when you add up all the different means that are being used to advertise to kids. That the worst foods in the company's portfolios are still being marketed most aggressively to children. So I think what you would have seen in that 6-7 year period wouldn't have been very positive. And one would conclude that there's a blight on America's children that's called food marketing, and the blight's existing as much as it was before. And that the progress that's being made is slight. There's some progress, to be sure, but it's slight and not nearly enough to capture the urgency with which the country has to deal with this issue of childhood obesity. So what's being done about this? Well, we have industry self-regulation, and we hear from industry and the people who are working for industry that there's progress being made, but the picture's not quite so positive when you get objective data from the outside looking in. And it appears that there's this, what Ellen has referred to as a dance between the threat of outside regulation and industry self-regulation. That is, the threat of outside regulation ramps up, industry takes the issue of self-regulation a little more seriously and moves ahead as slowly as it possibly can because it's protecting a very valuable resource. And in so doing, moves ahead inch by inch, but inch by inch just doesn't get us to the goal line in the rapid way we really need. So what can be done other than industry self-regulation? Legislation is one possibility. Is there any sign of legislative activity happening on this front? I don't see any myself. What about regulation? Well, the Interagency Working Group was a really good try by really good people, but it got crushed by the industry. Absolutely crushed by the industry. So is there any hope of the regulating bodies coming in and doing anything assertive and aggressive on this, given the urgency of the problem? At least not in the near term. Now, it would be nice if that possibility started to exist more, but right now it doesn't seem to be. So what's left? Well, one thing that's left is public outrage, putting pressure on the companies. And some of the things that we'll hear in the next few minutes will help address some of that, which I think is good. And the other possibility is litigation. Now, I don't know that that'll be talked about too much in our panel, but it certainly is a very interesting possibility. But the sad fact is that we're not making progress nearly rapidly enough. There are more meetings like this than used to exist. There are more papers in the literature, but these feel to me like weak efforts, like tapping the industry on the shoulder and saying, excuse me, it looks like you might be doing something that's not helping very much. Could we have a pleasant conversation about it? Well, you can get some things done that way, but if you can't get things done more quickly, then maybe it's time to pull the gloves off and do some more assertive things. And the question is, what would those be, and how can public pressure be mobilized? Is there a possibility of legal action that might help? And those are some of the things that we'll talk about in the upcoming panel. Now, I don't believe the tone of the upcoming panel will be as severe as the tone that I just created, but nonetheless, we're moving in the right direction, at least in my mind. So we have a terrific group of people, and I'd like to introduce them quickly and have them come forward so we don't eat into their time too much. First is Monifa Bandelli from the Moms Rising group. Next is Terry Wong from the University of Nebraska Medical Center. We're fortunate to have Cheryl Healton join us from the American Legacy Foundation. They've done wonderful work on tobacco. Samantha Graff from Change Lab Solutions. And then joining us by a teleconference will be Tim Lobstein from the International Obesity Task Force and the International Association for the Study of Obesity. So with that in mind, if our panelists could come and join us and take the stage, and Monifa, you could come right up and begin your presentation.